joining us on the See You Next Tuesday podcast. Today, I am super excited to welcome a very special guest, Dr. Antonio Bowens. Dr. Antonio Bowens is a traveling neurologist, and he is the owner and president of Bowens Locum Veterinary Neurology and Neurosurgery. He is also a widely published veterinarian, both nationally and globally, and he is a true thought leader in this field. And we are super excited to have him on the podcast. To date, he has supported over 200 hospitals through his consulting and traveling neurology and neurosurgery business. And that is how I was fortunate enough to meet Dr. Bowens via phone, because again, we are recording this during the time of COVID. So we had never seen each other face to face, but I happened to have a baby who needed some neurology work, and Dr. Bowens was treating him. And so I heard his voice on the phone and thought, I have got to get this guy on the podcast. And I could tell by the way he spoke to me, like, okay, he's kind of got the compassion gene that not all veterinarians or not all specialists have. So I'm super excited for you to be here. Before we get started, talking to you, Dr. Bowens, I just wanted to mention that nothing on our podcast today will be specific in terms of veterinary advice, because Dr. Bowens doesn't know you or your pet. So we're going to talk in kind of broad terms. In the show notes, I will include Dr. Bowens' website, and he can also let you know how to best reach out to him for telemedicine, consulting, whatever you need. So we'll get to that shortly, but this is not designed to diagnose or treat any illness specifically. So thank you so much. And I'll shut up and start asking questions, and we can get down to the fun part of this. So thank you for being here.
Hey, and Liz, thank you for that disclaimer. My wife would greatly appreciate that.
When we scheduled this podcast, Dr. Bowens said, yes, I can do that. Wait, I don't know what I can do. I have a wife. I have to check with her first. And I thought, he's a good guy. I get it. My husband has no clue what's on his plate until 5 minutes before. So I understand.
Hey. That's why we have wives. That's why we have
wives. We got to handle it. Handle it.
Exactly.
So you had a very interesting journey into veterinary medicine. Can you just kind of tell us about your background and how you got started?
Absolutely. So first of all, I got to state that this is a pleasure and an honor to be invited and be showcased on your podcast series today. Thank you so much for the invite. I'm originally from Akron, Ohio. My parents are from New Orleans, Louisiana. That's where I was born, but I grew up in Akron, Ohio. And, it's just been a pleasure. I initially started off being interested in human medicine. That's where I thought I was going to end up being as a professional, but God had other plans for me. And long story short, once I got into veterinary medicine, I still had the desire and the passion to go into the field of neurology and neurosurgery. And I had two classmates that said, hey, you can do that for dogs and cats. So the first African-American veterinary neurologist and neurosurgeon, Dr. Charles T. Lowry, was a graduate of Tuskegee University College of Veterinary Medicine, School of Veterinary Medicine when he attended, class in 1970. And he was a professor at Michigan State University. Well, Akron, Ohio from East Lansing is not that far. So I met him in my first year of veterinary school. And he said, hey, you can come up for the summer and spend a week or two with me. And after spending some time with him, I pretty much was sold on this is the area I wanted to go into. I had done research on the post-baccalaureate level at Tuskegee University, Vanderbilt, and Tulane as it relates to neuroscience and the AMPA receptors. And I also did some clinical research with Dr. Antoine Keller, who was a cardiothoracic surgeon at Tulane, looking at ischemia reperfusion injury and a neonatal piglet heart. And he's my mentor and my fraternity brother. I'm a member of Kappa Alpha Psi Fraternity Incorporated. And he really pushed the envelope in terms of me pursuing my passion and my gift. I would say my passion is in veterinary neurology and neurosurgery, and my gift is in teaching. I think in order to be a good teacher, both on the clinical level and also for veterinary students, clients and students have to know that, you care. People don't care about how much you know until they know how much you care. And that's a famous quote from our president, Theodore Roosevelt. And it's true. I think the difficult part about practicing veterinary neurology and neurosurgery is managing clients' expectations, because, it's a lot of stuff that you learn in veterinary school from the medical standpoint, but you don't really get the people aspect. I think now our profession is doing a better job in terms of helping new graduates to connect with clients. But, when I graduated, I kind of had to learn it, trial by fire and on my own, just in terms of realizing, and I hope people don't take this statement the wrong way, but people will go to the ends of the earth for their pet family more so than their human family. And, people are very involved in terms of wanting to know what's going on, a diagnosis, a treatment. And it can be very intense at times. They can challenge you and ask you quite difficult questions that they would be otherwise afraid to ask their human doctor. And so for me, what I've learned is that neurology is not always black and white. There's a lot of gray area and there's a lot of uncertainty. And since our patients can't talk to us, we really have to rely on the process. That being, you guys as the pet parents providing us with an accurate history, but not being information overload, because you guys, you pay attention to a lot of details. And then especially with the COVID situation, people have even more time to pay attention to what's going on and pick up on subtleties that we wouldn't necessarily pick up in the clinic, because when we're with your baby, it's just for a snapshot, and so they may not show all the symptoms that you guys are seeing at home. And that's why it's so helpful to have a good client-doctor relationship, and also sometimes to have video footage, because we rely on the history, the patient's signalment, which is the age, the breed, past medical history, pertinent medical history, pre-existing conditions. And then we take all of that information and perform our physical exam and our specialty exam, such as our neurologic exam. And then from there, we try to localize, where's the problem? Is it the brain? Is it the spinal cord? And then unfortunately, the field that I'm in, let's call a spade, it's expensive.
Yes.
To see a neurologist, I would say probably 9 times out of 10, there's going to have to be some type of advanced imaging involved, that being an MRI, which is considered the gold standard of diagnosis, diagnostics that we do, versus going to see, say, another specialist. The price might be a little bit lower than what the cost is on the neurology side of things. And so sometimes pet parents get upset with us, but, we don't make the prices. We just, charge accordingly based upon, what our lease contract states, or what the market value is. And so, anytime you get an MRI that's needed, the MRI unit by itself, and a lot of pet owners don't understand this, it costs the MRI for a hospital of any sort to purchase an MRI. It could cost you anywhere between $1 million to $3 million. That's just for one piece of equipment. Where for a general practitioner, they may be able to start a practice or build a practice for under $1 million. And so, we try not to, and every doctor is different. I try not to get into the financial aspect with owners, just because I know it's a sensitive topic. But long story short, that's kind of how I got involved in veterinary neurology, is through my mentor, my research, and my post-baccalaureate experience in neuroscience.
That
And
is so
it's a journey.
interesting.
Mm-hmm.
Well, and I want to go back to something that you said about talking to the pet owners. And I think you're unique. And I hope that veterinarian medicine is trending this way. But I want to just acknowledge how wonderful it is to hear a specialist honor that, yeah, your pet, and I know every little millimeter of their bodies. And if one thing's out of place, or that's not his right paw pad color, it's
Right.
just any little thing.
Right.
So I feel like a lot of times, not a lot of times, but often, I hear people that miss things, and it's easy to do if they're not getting all of that information and that knowledge from, the pet owner. My mother said the same thing about taking us to the doctor when we were kids. The pediatrician would say, no, it's this. And she's like, no, it's my kid. I know.
Right.
So I do appreciate you honoring that. And I've definitely noticed in the last probably 10 years that it seems to be kind of trending that way, where we're really emphasizing the human animal bond. And so I understand that you do veterinary neurology. I also understand a huge part of what you do is communicating with the owners. So
right.
it's huge, and it's invaluable, not just in treating the pet, but in whether you like it or not, you're treating that whole family as one entity,
Right. And I think one of the struggles, and I'm speaking for me, I'm not speaking for my colleagues in veterinary medicine.
Absolutely.
I'm not speaking for my colleagues in the veterinary neurology and neurosurgery space. I'm just speaking based upon my personal experience and, my conversations with my wife in terms of things that we noticed in the profession. And it's difficult because a lot of times you see a direct correlation in terms of the pet parent or the pet owner's thought process versus the monetary value that they invest in terms of trying to get answers, for their furry family members. And I get it. But I would say that I would ask pet owners to be mindful that just like money can't buy you love, money can't buy you a positive diagnosis. Money can't buy you a positive outcome. Sometimes, especially in cases like, autoimmune diseases where patients have encephalitis, we don't know how the patient's going to respond to the medication.
Yeah.
So, you'll have some owners, not all, but you'll have some, they'll get frustrated because they're like, hey, you're saying it costs this much money to pursue the treatment, and we don't know whether it's going to be a positive outcome or not. And, it's hard as a pet owner myself, as a veterinarian, to have conversations with pet owners where they want guarantees. And unfortunately, we can't get, even with surgery,
Sure.
I tell people all the time, a spay and a neuter, that's not a simple surgery. The surgery itself is simple, yes, but anytime you have anesthesia involved, drugs involved, you don't know how patients are going to respond to certain medications. The example that I use all the time is in veterinary school. I had a classmate that I would study with. Well, when I took no-dose and I drank coffee, it kept me awake. When he took no-dose or coffee, it made him sleepier. So that's a prime example that, even though the medication is supposed to stimulate you, help you to stay awake, different people respond to medications differently. And the same thing holds true for our companion animal patients. And so a lot of times we can't dictate, how they're going to respond to medication. And then it's not a fault of the veterinarian. All we can do is the best that we can. And I wake up every morning honoring the oath that I took when I graduated from veterinary school. And I would hope to think that my veterinary colleagues are doing the same. We invest a lot of time and energy into our craft. And, I'm fellowship and residency trained in veterinary neurology and neurosurgery. I am not a board certified veterinary neurologist, but I have the training, and I've been doing this now for almost 20 years. I did a rotating internship a specialty internship in neurology and neurosurgery. And I also completed a residency in neurology and neurosurgery in Zurich, Switzerland at the Tierspital. So, for me, I try to shoot straight with the clients. And if there's something that I'm not sure about, I'll tell the owners, hey, I don't know. I don't know what the chances are going to be, but I try to give clients reasonable percentages that they can take because basically I'm a resource. I'm here to provide you with information to help you make a decision that you can feel comfortable with. And so you and your spouse can make an informed decision, because ultimately this is your baby. It's my patient, but it's your baby. And that level of respect is definitely given from veterinarians to pet owners. And, it's what we do is not easy. I mean, there's plenty of times where I'll look at a patient and say, Peter, how you feeling? Tell me what are you experiencing right now? And I wish we had that luxury where we could look to our pet patients and say, hey, where are you hurting? How are you feeling? How does this drug make you feel? Mom and dad sees this, but what are you seeing? What are you feeling? And we don't have that. We don't have those variables at our disposal to utilize. So we have to weigh heavily on mom and dad and our physical exam and clinical signs to try to piece all the pieces together of the puzzle. And that's what I try to stress to my veterinary students is, hey, you're an investigator. You're trying to put the pieces of the puzzle together. And, respect the pet owners, respect your technicians, because even though the technicians don't have the clinical knowledge that you do, a lot of them have the experience, and experience does play a major role. It's not everything, but it definitely has its place within trying to work up cases and do what's in the patient's best interest. And at the end of the day, that's what we're trying to do. We're trying to work with pet owners, the referring vets, whether it be another referral hospital, specialty hospital, the family vet or general practitioner, to try to do what's in the best interest of our patients. Right.
Yeah, that makes so much sense. And I totally agree with you about the vet techs and veterinarians. I think vets are the hardest working people in showbiz, no doubt. And, as a lot of our listeners may not know, there's a vet shortage. And I believe, I don't know if this still holds true, but the last that I heard, veterinarians deal with so much that, indeed we've taken over dentists in terms of, or not we, you have taken over dentists in terms of the highest suicide rate. It has got to be the most challenging career out there. So as hard as it would have been to go into human medicine, you just picked an even more challenging career 20 years ago. I mean, it is really, I respect so much what you do, because that is a huge part of it. You are investigators, and to see, to add the piece in of listening to the pet parents and really, really gauging that, and to respect your teammates and know that having a great team of techs behind you is part of what makes you so good at what you do. I think that's amazing. That's amazing.
Yeah. And that's, oh, go ahead. I'm sorry.
No, you go ahead. Go right ahead.
No, I was going to say I appreciate you pointing that out, because right now, veterinary medicine out of any profession in the world has the highest suicide rate. And, this mental health thing is real. It's important to maintain your physical health, but your mental health is just as important, if not more so important. And when you look at the demand in terms of work-life balance, managing client expectations, trying to see, right now, depending upon where you go in the US, it may be a 1 to 3 month waiting list to see a veterinary neurologist.
Yeah.
And so we're trying to do our best to see, as many cases as we can within a day, but also not to overload ourselves in terms of, staying there until 10, 11, 12 o'clock at night when we have to come back the next morning.
Yeah.
And it's, I think it's multifaceted. I think some of it has to do with whether you're an introvert or an extrovert. And like I said, there's a lot about veterinary medicine that I've learned over the years that I would have never known if I just didn't do it, in terms of practicing. And, you have a dynamic where, pet owners call you, they want to talk to you, but then you have cases that you're trying to get in from owners that have waited a month, 2 months to be seen. And it's tough. And having to stay up with the medical records and to try to be as thorough as you can on that, it's really a tough thing to manage right now.
Do you think it's changing? Do you think that now that we've kind of began the process of ripping that Band-Aid off, if you will, that do you see more best practices being put into place that actually take those things into consideration, the work-life balance? Because I feel like a lot of professions, I come from the nonprofit world too, animal welfare. And so there's this, you love it and you love these animals, right? So why can't you just do it? Like, what's the deal? And that is such a small piece of what it is that it and I know veterinary medicine certainly doesn't lack professionalism, whereas the nonprofit has its own challenges with that. But I do think in these careers, there's an expectation of, well, it's your calling, right? Well, yes, but I have gazillions of dollars in debt that I got to pay back. Good luck buying a practice if, you're not a huge conglomerate. And so I get it. Do you think it's trending in a way in terms of like whatever it looks like, telemedicine or putting?
To be honest with you, I think it's too early to tell.
Okay.
I think, and like I said, I'm just speaking for me.
Yeah, totally.
My wife and I, we noticed this way back in 2006, 2008. And I remember us having very deep academic discussions about the psychology behind veterinary medicine. And now, almost 15 years later, now it's a hot topic. But I think it's too early to tell. I definitely want to give kudos to the millennials, recent graduates, because they're pushing the bar for change to take place. And I don't want to consider myself old school, but more seasoned veterinarians, I definitely can appreciate where they're coming from. I think there needs to be a balance. But in hospitals that I've worked in, if I'm being honest, I see a lot of pushback from clients because so here's the dynamic. Because there is and this is just my opinion, because there is a shortage of veterinary clinicians, I think there's an increased number of patients that need to be seen. I also think because of COVID, people got more pets because, they were lonely, bored, or what have you. And I think because of the dynamics that have taken place as a result of COVID, the combination of the two has allowed for things to kind of get out of whack. And so it's tough because you have an increased number of cases that need to be seen, or we can just say the same amount of cases. But now you have a shortage of veterinarians, and it's making it very difficult to manage cases and to give the cases the attention that they need, let alone to get them through the door. And so there needs to be more work done, but I think it's going to have to be a give and take from the veterinary community as well as the pet owner community. And I know that may sound kind of weird, but the reality of it is for pet owners, something to them may be an emergency that may not necessarily be an emergency on our side.
Yes.
And I can, I'll give an example. I would say a lot of general practitioners or family vets, neurology cases can be overwhelming.
Yes.
So a lot of times, those cases are immediately referred to a veterinary neurology service. Well, for someone practicing in the area of veterinary neurology and neurosurgery, a patient that's having, say, vertigo issues isn't necessarily an emergency for us versus a phone call that we receive of a dog that's paralyzed.
Right.
And so now, there's that disconnect there where the pet owner is like, man, this is a problem. My dog or cat needs to be seen. And hey, I agree with you, it does. But then if we already have a full schedule for the day, plus we're taking in transfers from the emergency service and we're getting calls from outside veterinarians, now we have to kind of pick and choose what's really a true neurologic emergency. And so
you're kind of triaging without, yeah, that makes sense.
And it's difficult. And so, you can kind of tick off people, but that's not our aim. We're just trying to do the best that we can to say, hey, this case really needs to be seen.
Yeah.
Your dog that's having a head tilt and some vomiting issues, okay, see if you can work with your family vet to kind of mitigate and attenuate the clinical signs and symptoms. And it's, like I said, it's tough because, say, for instance, the emergency service is a service that I work with very closely aside from the general practitioner. Well, if they're already swamped with, like patients that need abdominal surgery, cats that have urinary blockage, they're kind of stuck too, because their main goal is to stabilize the patient, to get the patient to either be transferred to the appropriate service or to send the patient home. So that's the emergency clinician. Their job is to make an assessment and to try to get the patient stable, a diagnosis, and get the patient stable to be transferred to the appropriate service. So, their hands are kind of tied too. And then let's look at it from the general practitioner side. A lot of times they don't have the resources to manage these cases. So their hands are kind of tied too, because, even if it's a comprehensive general practitioner, they may not have the means to house a patient that has severe signs of vertigo where they're rolling and, alligator rolling or walking in circles. They may not have the staff to manage those cases. So they're kind of put in a bad situation too. So it's making for the perfect storm right now, the shortage of veterinary clinicians and the increase in the number of pets within the household.
Yeah. And not only that increase, but I think, and hopefully this is kind of scaled down a little bit, but I know in the beginning of COVID, people were just noticing things that their pets did. So, you talk about, well, this seems like an emergency. Well, how long have they been doing it? Like really 6 months.
Right. And that's why we have to ask that question. And that question is not to be offensive to a pet owner. We're just trying to get a feel for, okay, how long has this been going on? Like, do we have time to say, okay, let's try this first before, going into an emergency facility. But yeah, it's a tough thing to balance.
It's really tough. It's really tough. I've just noticed on like the hiring side of vets, it went from more difficult to even emergency clinics are so overrun right now that like if you have a true pet emergency, it's even hard to get them in,
Yes.
as we'll soon be seeing with humans, unfortunately.
Mm-hmm. Yes.
Well, what are some of the most common things that people should notice or should pay attention to at home? Humans, unfortunately.
Yes.
Well, what are some of the most common things that people should notice or should pay attention to at home?
Okay.
And then I want you to talk a little bit about, so your process, let me back up just 1 second. Your process is to work with only veterinary and general practice referrals, correct?
Correct. And
Okay.
also emergency hospitals.
And emergency. Okay. Okay. Awesome. So yeah, I guess back to that then. Tell me what some of the symptoms look like for some of the most common conditions that you see, that things people should pay attention to.
Okay. Liz, that's an excellent question, because that's when I start off teaching my clinical neurology course to the students at Tuskegee University and also here shortly to the University of Arizona. I tell them that the most common neurologic cases that you're going to see in practice are the following: forebrain disease, which is, cases that are going to cause patients to have seizures, behavioral changes or changes in mentation, circling, wide circling or pacing. Also, vestibular disease. In veterinary medicine, we call it vestibular disease. In human medicine, they call it vertigo. Yeah. So those patients most commonly will have a head tilt, have signs of nausea, vomiting. They'll have funny eye movements, which is called nystagmus, where they'll kind of have involuntary movement of the eyeball. These patients will have tight circling. They'll have gait abnormalities or gait incoordination, which we call it ataxia. Patients that have spinal cord disease, and that can vary depending upon where along the spinal cord that the patient's affected. A patient that has a problem in the neck is going to have or may have different symptoms, and they use symptoms in human medicine and veterinary medicine. We refer to it as clinical signs. The clinical signs may be different in the patient that has a cervical problem, meaning in the neck, versus a patient that has a problem in the mid-back area. So those things can range from neck pain, back pain, gait abnormalities on all four, but the mentation being normal, knuckling over, and you can get knuckling also with patients that have brain disease in certain parts, problems urinating. And then, if you're in emergency medicine, head trauma is a big one. So I would say the four main common neurologic conditions that most owners may see, or we're going to see in general practice or emergency medicine, is going to be patients that have problems in the forebrain area, the vestibular system, spinal cord disease, and then unfortunately head trauma, which a lot of times is due to a hit by car or some type of concussive force to the skull. A kid accidentally is playing, baseball in the backyard with one of his siblings or a friend, and the dog gets in the way and they accidentally, hit the dog with the wiffle bat.
And then the client has to get rid of the child and take care of the dog. That's terrible. That is really sad. Really sad.
Yeah. So, so it, like I said, it can be challenging because, let's be honest, and I'm speaking now from a vet student's perspective. When I first started seeing cases of patients having neurologic problems, it was kind of scary. I mean, it was, because a lot of times I can still remember my senior resident, Dr. Peter Gordon. He practices right now in Vancouver. When I was an intern, there would be cases I would have to manage just on emergency just to get it transferred to the neurology service the next day. And I was a little nervous because it's like, okay, this is the first time. I mean, you read about it in the textbooks and you see videos, but
it's
now
scary.
Yeah, you're having to manage this, and it's difficult. So
plus, you were all hopped up on no-dos and coffee. So yeah.
Yeah. So imagine
Yeah.
if I had those feelings as a veterinary student. Well, at that time I was an intern, so I was a doctor that was green. Imagine how a
Yeah.
pet owner feels. And
Yeah.
you wake up in the middle of the night and your dog's dragging its back legs. I mean, you're freaking out. And so
It's
I get it.
terrifying.
Yeah.
Yeah. I had a dog with vestibular disease, and I just immediately was like, stroke, it's having a stroke,
Right.
and
Right.
no. And it was
Right.
such a surprise to me. I just had no clue at that point what that was going to look like. I really
Right.
didn't.
Right. And we get that commonly. Hey, my dog had a stroke. Well, what people don't realize is, yes, some of the symptoms that human patients have,
Yeah.
our companion animal patients can have. But for us, stroke is just a diagnosis.
Yeah.
Depending upon where the stroke takes place within the brain, a brain tumor can cause similar symptoms or clinical signs. So the onset may lead you to believe that your dog or cat
Yeah.
may have had a stroke, but in terms of symptoms, it really depends on where neuroanatomically the neuropathology is taking place. Is it in the forebrain, midbrain, hindbrain? And so it can be scary for pet owners for sure. I definitely,
Yeah. If it's terrifying for a vet, I can only imagine.
yeah,
That's scary. Oh, I bet those were some long nights in emergency
yeah,
waiting until 7:30.
yeah.
Like, come on, Dr. Gordon.
Absolutely.
Oh,
Your internship years, I mean, especially like I would say probably the first 3 to 6 months, it's it can be scary because, like I said, some of the cases you read about them, but you haven't seen them yet. And so that's why it's important, like I said, that's why it's important to be respectful to the technicians, your senior clinicians, basically really be open to listening to what the owner has to say in terms of clinical signs, because you guys are spending more time with, your furry family members than we are. We're just getting
yeah.
it's a snapshot visit. That patient is only with us for, an hour.
Yeah.
You've been with Peter for,
I've been obsessing
months.
on that little butt his whole life,
Yeah. Yeah.
Yeah. And that was actually how I ended up at the hospital where I ended up meeting you, because he had IMHA. And so we had been through blood transfusions, all that good stuff, and thought we were good to go there. And then one day I was like, nope, something's off. Something's off. And I still don't even, it was so slight, but thank God I noticed, and thank goodness I was home to be here and it was very slight. I don't think a normal person didn't drive her dogs crazy from watching them all the time. But yeah, that's, and you are a pet owner as well. Tell me what
Yes,
you have.
I
I
am.
totally forgot to ask at the top of the show.
Yes, I have a beagle. His name is Etouffee. That's my wife's baby. When I met her in veterinary school, she had a beagle, and so she had been tugging on my coattail, saying, I want to get another dog. So we have a beagle. His name is Etouffee, and we have 2 kittens, Apollo and Sprinkles.
Oh
So
my goodness.
instead of me having 2 kids, I have 5.
And 2 girls, right?
Yes, 2
And
girls.
then that's amazing.
Yeah.
That's amazing.
Yeah. And so, so they keep us busy. They keep us busy.
I bet they do. Are the girls mouthy? Those are my favorite kind of girls.
No, but they're very opinionated.
Yeah, that's what I mean. That's what I mean.
Yeah, they're
That's
very
the
opinionated, and
polite way to say it.
and they pay attention to subtleties when things are going on with the kittens or Etouffee, and it's pet parents are, you guys are the first advocates for the companion animals for sure, because you guys, you just see stuff that we may not be privileged to see upon a vet visit. So yeah.
And you really honored that relationship, and I just think that is so cool. So again, I just want to say thank you for that, because it's such a huge deal. And I can remember I don't know, 20 years ago when I had my hateful little Shih Tzu Yogi, and he was such a jerk, just such a jerk, you know. But that dog saw me from 16 years old until I was 30. And
Wow.
then he died like the week after I got married. He lived 7 years, probably longer than he should have anyway.
Wow.
He had some medical stuff, but you know, that was my heart. And I mean, they see you into those big moments, whether good or bad, they're there for like all these seasons of your life. And I would feel so ridiculous saying like, no, that dog probably actually saved my life. You know,
Yeah.
I mean, they do. It's pretty incredible.
And that I appreciate that point. That's another aspect of veterinary medicine in terms of practicing that you didn't, or I didn't appreciate.
Right.
There have been pet patients of mine that have gotten pet owners through a divorce, through breast cancer,
Yep.
PTSD,
Yeah.
and you don't, you didn't know that, and I don't mean this in a bad way, but I didn't realize that, okay, this is just not a pet. Like the pet has, family relevance and significance, but also mental, emotional, psychological significance and value dependent upon, dependent upon that person's experience. I never forget I had a patient that I diagnosed with encephalitis, and I got the patient stabilized because anytime you're dealing with like encephalitis, these are autoimmune diseases, and they can't necessarily, I don't like to use the word treated, because a lot of times for pet owners, treated means medication and then it's done.
They're better. Yeah.
Right. They're better, no more. So these patients have to be medically managed. Some of them, you can eventually get them off of medication, but for the most part, a lot of them, since the disease that they have is an opportunistic disease, you have to manage the case long term. So long story short, mom starts crying and saying, my husband recently was diagnosed with, stage 4 pancreatic cancer. And so, you don't realize that, hey, we don't have human kids.
Yeah.
When we got married, this was our kid. We bought a dog, 2 weeks after we got married. And so that's a lot. And so you start to understand the psychology of the practicing side of veterinary medicine and why, this dog or cat means so much to this owner. Another common one, either a male or female, they're a widow, and this was my significant other's dog. And I'm just trying to, I had a guy travel almost 3 hours to see me, and he said, "Doc, this was my wife's dog, and so we got to keep her alive." And it's like, man,
No pressure.
Right. And it's like, man, but it's or my human child got into a car accident and passed. This was his or her dog. And it's just like, that it just, oh man. I mean, I have stories, and it started getting to the point where I was like, man, like I really have to kind of, step back. The part of the job I hate euthanasia. I know it's a part of my job description, but I hate it. You see families just going through the process of making a decision and having to endure that process of being euthanized. I told my wife that I feel like, every time a patient's euthanized, a part of me dies. And I performed countless euthanasias, and I want people to know that we as practicing clinicians, I would dare to say that most of us hate that process. I mean, I hate euthanasias. I mean, it's a process, and to hear people scream when that procedure is over, and to mourn and grieve. I mean, it's tough. And so, that aspect of veterinary medicine is real too,
Yeah.
And so,
You guys cry, you go in the back room afterwards. And I get it, man. I don't get it, but I can imagine.
Yeah.
And certainly, we should all hold space for the kind of decisions that you have to help people make those decisions too, which I cannot imagine is, but I really, I don't think that gets talked enough about. And so just, from a client standpoint, thank you, because I cannot imagine how.
It's always a difficult conversation to have. And I had to learn how to communicate with clients during that process, because I really didn't know what to say,
Yeah.
So I just, like I said, I'm a resource. I'm here for clients in terms of me providing them information about their babies to help them make informed decisions. I don't make decisions for clients. I promise myself I won't do that. I can only give them my perspective on things, but ultimately they have to make a decision that they're comfortable with.
Yeah.
And, certainly if there are cases where, if the owner asks me, hey, do you feel like it's time? I'll say, well, given this standpoint or that standpoint, I don't think it's necessarily time yet, but ultimately, he or she lives with you. And so, if you have a patient that has, uncontrollable seizures and they're chronic, and you work a full-time job and you don't work from home, those
quality,
things,
man.
and you have to look at the quality of life for your baby, and you have to look at your quality of life. And you can't, you should try not to be selfish, And I know that's a tough decision to make too, So I've had to euthanize my own pet before, and that was tough. But you have to really kind of sit back and take all the information in and make the best decision that you can, because it's not easy. But definitely the euthanasia process is something that I don't like doing at all.
What's your favorite part of what you do?
I like the investigative approach. I like seeing the patient, trying to figure out where neuroanatomically the patient's having problems, and then confirming my findings based upon the diagnostic test that we perform. And a lot of times, what I do, the MRI is the gold standard for diagnostics. So that's the part that I like. I like the investigative approach.
Do you have a favorite part of the brain?
I really like the forebrain and vestibular system. The vestibular system is a little more intricate and complex than the forebrain area. And so, I would say that is one area where, you can see kind of like a laundry list of clinical signs to just maybe one or two. So I would say that's definitely the area of the brain that most intrigues me. With veterinarians being the leaders of public health in terms of the zoonotic aspect, there's a lot to be gained from MDs working with veterinarians and vice versa. And then also veterinarians working with their communities. And so that's the one thing that I've been trying to do is build stronger relationships with people within my community, not just on the veterinary side, but pet owners. There's a lot of information on Google. Some of it's misleading, but it definitely, in terms of a broad sweep, it's definitely helpful information for the pet owner, especially if you get in a situation where your dog or cat is having some weird clinical signs, late in the evening, middle of the night, that you can kind of, just research and kind of get a feel for what's going on or what may be going on. But just having that level of respect for one another in terms of, hey, this is what I researched online, but I'm deferring to you for your opinion. And, just the pet owner and the veterinarian working together to do what's in the best interest of the pet patient and the furry family member. So,
yeah, because once we all have buy-in, it changes the game, and I do think you're right. I think there's a lot of, it feels like the most important thing to you in the whole world if it's your dog. And I get that. But if there are 10 other cases that are just higher priority in terms of who you need to, stabilize first. So be nice to your vets, people. Just please, please, please try to have some understanding. And my gosh, there are Karens at vet clinics too, and especially emergency and specialty. Like, I get it. But
and hey, be nice to the CSRs and the technicians.
Yes.
Because they play a major role in what we do. They don't make the same sacrifices, but they make similar sacrifices. And a lot of times they're the face of the practicing profession, because a lot of times before you even talk to the veterinarian or meet your veterinarian, the CSR and the technician, they're kind of setting the tone. And so definitely show them a lot of love and respect as well.
Well, Dr. Bowens, thank you so much for visiting with us today. It was such a pleasure, and I cannot wait to speak to you again.
Likewise. And for anyone wanting to reach out to me, please feel free to visit my website, www.drantoniobowens.com. You can also email me at Bowens, BOWENS, vetneuro@gmail.com. I'm an extension of your family veterinarian, and I'm also an extension of your referral hospital. I work closely with pet owners, emergency clinicians, and general practitioners. And it's been a pleasure talking with you all today. And I hope that I was able to leave you with some neuro nuggets of information and kind of a better appreciation from the doctor's side of things in terms of how things flow and some of the challenges that we face in terms of trying to get you all the information that you need to help you make informed decisions about your furry family members.
Absolutely. And we appreciate you, because it is about this relationship and we all have to work together. And so you're right. And from this side of things, we absolutely need to hold lots of space for you guys to do your job and communicate in the way that works best for you. And we need to be a little bit more patient. And I also...
And likewise on our end. It's a two-way street. So likewise on our end. So.
Yeah. Because the dogs aren't paying for any of this, per usual. But I do want to just be clear that it is possible to buy off staff and vet techs with good food.
Those things are helpful. Those things are helpful.
Right? Okay. Putting it out there. Well, thank you again. Have a beautiful rest of the day.
You as well. And I look forward to talking with you our next series.
Awesome.
So
I'm going to put links to every your website, your email, so that you can reach out to Dr. Bowens if you'd like to in the show notes. And thank you so much.
Thank you. Take care.